Well, we continue our focus on the NHI Bill. I'm joined now by Corbett from the South African Health Professionals Collaboration. So we've seen an extension of that vote that was scheduled for today. Your collaboration, of course, had already said earlier on in the week that you would not want to see this vote going ahead because there's still so many unanswered questions that you feel were not adequately addressed during the submission phase.
Absolutely. Thank you very much for having me today, representing over 25,000 allied health and specialist and GP organizations within South Africa. We're a conglomeration of 9 associations, so the large majority of those people that provide healthcare in this country. And we're deeply disappointed in the process thus far, but actually celebrate this postponement to the 6th of December in the hopes that there's time now for them to actually review, listen to, and closely look at what the submissions have been thus far, providing different solutions to what is in the bill. We absolutely celebrate universal access to quality healthcare, but the bill is not that solution, not in its current format, and we have enormous concerns around the implementation or the attempts to implement the bill as it stands.
6th December is literally next week. There are only a couple of days, and I think the point that has really been made is that there have been serious questions asked about the extent to which Parliament has given itself the opportunity to at least take into account the majority of submissions made, and those, of course, go into, it's hovering just over the 20,000 mark because there's just so many things that different South Africans have had to say. In what ways do you believe that this has brought the healthcare sector together? Because we do have a unique situation where different organizations, as the collaboration is, activists, all are singing from the same hymn book, although raising very different points in some instances.
I think it's long overdue, but I think we saw a big shift during COVID, where we saw public-private partnerships for the greater good of South Africans versus the very fragmented healthcare sector that we know exists within South Africa. But this is a monumental occasion to have such an enormous vested interest from our health workforce to stand together and say, please pause and listen to us. We're the matter experts. We're not only patients, but we're healthcare providers. So we have enormous skin in the game. We have a huge amount of insight into the space. And we've already seen successful public-private partnerships that did not require the funding mechanisms that have been, albeit very poorly outlined, within the National Health Insurance Bill. And so I think that we have both the experience as well as the enormous passion and drive to see all of South Africa pulling together to support the engagement with stakeholders. We plead that they stop and just listen to us. We have all submitted a huge number of documentation and various submissions to Parliament to say we're not against universal access to healthcare. We are 100% for it, and health reform. This is not the solution. Please, can you engage with us? Sit down. Let's look at the constitutionality. We all support the right to access health. It's a fundamental constitutional right. And if we can sit around a table and have the discussion, I believe that there are solutions at hand.
All right. That is Corbett with the South African Health Professionals Collaboration.